Okay, good afternoon, everyone. We think there's quite a lot of you out there. My name's Tom Venables. I'm currently the chair of RTPI London. I work for Pryor & Partners. We were planning to do a series this year on kind of ideas around urban planning specific for London, which we were actually going to have the first one next week as a face-to-face thing with the drinks reception and everything like that. Obviously, we can't do that now, so we thought we'd take it online. This is our first attempt, so apologies if anything goes badly wrong. So please bear with us. We've been practicing, but hopefully it will go well. We'll have to keep everyone muted because we're expecting quite a lot of people, but we can take questions on the chat bar. So if there's anything that you'd like to ask us as we go through, then please just type it in and we'll try and respond to the panelists. So I'll just introduce today's speakers, and we thought with the first one we'd ask actually people, to friends and colleagues who all kind of share the fact they've worked in London in the past. So we've got Cristian Bevington, who oh, I've gone too far, who is a cities analyst and planner with AECOM in San Francisco, who I used to work with in London, and actually we worked together in Istanbul, a number of kind of city scale resilience projects. We've got Celeste Morgan, who did work with us at EDOR and AECOM in London and is now back in Melbourne, where she works at E2 Design Lab. So Celeste got a background in sustainability. She did a lot of work, a lot of real pioneering work around water sensitive urban design and green infrastructure, and how that was applied to the Olympic Park Master Plan, amongst others, across London. George Weeks, who a lot of people from RTPI London will know, he used to be our quiz master before he moved to Auckland, where he's working for Auckland Council, previously at TfL. And then in London, I'm joined by Aude Bicquelet, who leads a lot of the RTPI's policy and research. And part of the idea of the series is actually, I chair the RTPI's policy and practice and research committee, was to showcase a lot of the work and the ideas that's coming out of the RTPI. And so the series will start to kind of come and start to apply some of that thinking for London. So the idea is we have a 5 to 10 minute presentation by everyone, and then we will follow that up with Q&A and a discussion. We've also got a couple of polls for people to get interactive on, so hopefully we'll get some stuff out of that. Right, I'm going to try and give control now to Cristian. I think he might already have, actually. Hang on.
Nope.
We'll see if it works. So Cristian, is that working?
Okay, let's see if we can get that to work. Has it changed for everyone?
Not yet.
Fell at the first hurdle.
Fell at the first hurdle.
How about now, Tom?
No, try moving the mouse. There you go. There we go. Technology.
Business. Right, we've got it. So as Tom said, I'm Cristian. I work in the cities team in AECOM in San Francisco, and I'm just going to share some lessons learned from what San Francisco is doing in response to the COVID-19 pandemic. So there is a slight lag. Here we go. So first of all, I just wanted to couch this in the context of the US, and I think many of you are aware that the United States is the country with the most number of cases of anywhere in the world. This has jumped up significantly over the course of the week, and we're now registering close to 700,000 cases. As you can see from the maps, the distribution isn't uniform across the country, and some of the slides that I'll have after this should give some indication as to why that is the case. For example, on March 10th, New York had 7 cases and San Francisco had 14. But by April 16th, New York had 123,000 cases and San Francisco had just 1,000. So across the US, states have had different responses to the problem. I don't know if that's changed for you guys.
No.
Not yet. But California was the first state to implement a shelter-in-place order on the 19th of March, with other states following suit. What's interesting with this is it's the first time that all 50 states are under major emergency declarations in history. And what that does is it allows the states to access special federal pots of money and gives them certain powers for responding to issues such as this pandemic. What's also been interesting is that states are collaborating together, not so much with the implementation of shelter in place, but the reopening of states after this. So California, Oregon, and Washington are going to be working together post COVID-19. If this changes. What I wanted to do is just give an overview of what's happening in San Francisco. Has that changed, Tom? Nope. There we go. So San Francisco and 5 other Bay Area counties were actually the first places in the US to implement shelter-in-place orders on the 16th of March. So that impacted 6.7 million people and was actually 3 days before California itself did that. It's expected to remain in place through May 3rd, though unclear as to whether or not we'll actually be allowed to leave our homes on that date or if it's going to be extended further. Similar to in the UK, what that means for us is that if you can only leave the house for essential needs or if your work is considered to be essential. So some things do remain open. Schools are closed in San Francisco and are likely to remain closed through to the following academic year. Construction has to stop except in special cases. So if you're working on a project that's considered to be essential infrastructure, that can continue. And what's interesting is that if you're building a project that is residential or mixed use that has a component that is affordable, you can actually continue to run that project. They've also been lucky enough to be able to respond in an agile way. So as many of you are aware, San Francisco has a large vulnerable population, which can include homeless people, but also includes other demographics and other groups, such as those that are experiencing domestic violence and the like. So what they've done is they've distributed that population more than they would normally be distributed. That was shown to be effective on April 10th, when there was an outbreak in a shelter, which would normally house 350 people, but on that particular day only had 120. That reduced number allowed them to convert the facility into a mini hospital and to redeploy medical staff to that facility. They've also been supporting students who are long distance learning by providing Wi-Fi hotspots in areas of need, because they realized that 29% of state students don't actually have access to internet at home. So if you don't have access to that internet, how do you continue to learn and partake in the curriculum? San Francisco has also been supporting local businesses through special grant programs. So they already had a resiliency fund in place, but this was extended to allow businesses that are experiencing difficulties to access interest-free loans, grants, etc. And something that I thought was quite interesting, because I hadn't ever thought about this, Mayor Breed, so the mayor of San Francisco, implemented a cap on the service charges that third parties could charge to restaurants and takeouts, because what they were realizing is some of these were charging astronomical fees, which was actually making the operation of those businesses near impossible. And as many of you know, San Francisco and Silicon Valley is home to many of the world's biggest tech companies, and they were actually on the forefront of implementing work from home. So on the 12th of March, many of those big firms like Facebook, Google, Twitter actually told their employees that could to just stay at home. So that even predates the work that San Francisco has been doing to keep everyone safe. So that's a run through of some of the policies and things that San Francisco has been doing. And what I thought I'd do is just pull together some thoughts and maybe some lessons learned that might trigger some questions and some conversation after. So we need to listen to the science. Don't let politics get in the way. So January 22nd, there were only 555 cases globally. By March 22nd, there were 335,000 cases, and obviously now we know there are significantly more. Did we do enough? Did we listen to the warning signs? Arguably not. Could we have done more? Now, this is one of the topics for discussion. Is density the villain? Are cities the villains in this story? And I think in a time of physical distancing, it's easy to say that yes, they are. But I think it's important that we remember that cities are homes to huge wealth of knowledge and are some of our strongest global economies in of themselves. And we don't want this to necessarily be detrimental to how those cities function moving forward. So we want to keep them being dynamic. We want to keep them being places where people come together. What has been interesting in this situation is that places like San Francisco, so the second densest city in the US, and Hong Kong have demonstrated that density in of itself isn't the only thing that causes pandemic spread. What they've demonstrated is that a carefully timed and coordinated response can actually heavily limit the impacts that pandemics have on populations in those cities. We need to integrate preparedness into our long-term planning. So we don't want this to be the only guiding principle, but it's something that we need to think about early. So do we have these plans in place so that they can be actioned in an effective way, an efficient way, and that we're building in redundancy and flexibility? I'm not sure if that slide actually changed or not. There we go. There we go, stormy clouds. And then resilience isn't just climate adaptation. So many cities around the world have resilience strategies in place. And what's often happened is that climate adaptation and climate change has taken the limelight. But actually, many of those strategies did include actions that were specifically related to pandemics and health crises. So we need to make sure as we move forward that we are giving all actions and all topics in those strategies an equal share of our attention. Has that slide moved forward, Tom? It's frozen on mine.
That better?
Yeah, if we could go to the next, here we go.
Yeah, I'll just move them, yeah.
At a time like this, there's huge amounts of attention being placed on the pandemic, but also with that comes large funding pots. And what we need to do is look at how we use those funding pots to not only solve for the immediate threat, but also to keep working on long-term issues like climate change. So the stimulus checklist that's shown on the screen now is something that AECOM prepared, the idea being that those who are applying for funding or those that are allocating funding could run through a checklist like this to make sure that everything that they're allocating is bringing multiple benefits and will maximize return moving forward. Next slide, Tom. We should take back the streets. So at a time of low traffic numbers, we should be giving streets back to pedestrians and cyclists. It allows people to get outside, to exercise safely, to keep their distance. But one of the questions I had is, well, do we want to give the streets back to the cars? I've enjoyed being able to have more freedom in public space. Oakland in California, so just the other side of the bay from San Francisco, has actually opened up 74 miles of streets for walkers and cyclists. And the hope is that we'll take some lessons from this and people will feel the benefit and want to keep some of that moving forward. Next slide, Tom. And then finally, do we want to move the water cooler to virtual? So much like we're doing now, can we look to bring things online and think about things more flexibly? So I think what the pandemic has shown is that for many people who are lucky enough to be working from home, that we can do so effectively and also do so at scale. If we continue to do this, it could change the type of office spaces that we need, the size of the office spaces that we need, and also how we work. So I think many of us has probably experienced that some meetings don't need to be meetings and could have just been an email or a call, which I'm very grateful that hopefully we'll be taking some of those lessons learned moving forward. With all this bundled up, it will reduce commuter trips and would have improvements on air quality and reduce traffic overall. So there were some thoughts from me. I shall pass the baton over to Celeste. Thank you.
Wonderful, thanks, Cristian. Right, Celeste, let's see if it works for you this time. Oh, hang on.
Sure.
Let's.
Oh, hello from Melbourne in Australia. Let's see if we can click on through. So I wanted to, I guess, play devil's advocate a bit and discuss, I guess we're all fans of cities, but do our cities need to be lower density, and what benefits can we get from that kind of lower density environment? So Melbourne, where I'm coming to you from today, is very much an example of that. We're about 1/10 of the density of London and 5 times the geographical area, which comes with its own issues in terms of travel times and commutes. But it really comes into its own in a pandemic time, I think, with the access to green space and just space generally in this type of city. And I think planning in Australia has generally resisted moves towards density, aside from the very centre and the CBD. We're still building at about 15 dwellings per hectare in the growth suburbs and gradually expanding further and further out from the centre of the city as Melbourne grows. So is this the rise of, or the victory of suburbia? Interestingly, this kind of thinking about suburbia was kind of born out of pandemics in the first place. The Spanish flu in 1918 definitely led towards new cities being built with suburbs in mind, and that lower density escape from high density hectic environments where disease spread rapidly. I was reading today that LA was actually kind of advertised as the automobile city, where if the husband had to drive into the city to work, if he was put at risk of catching disease, at least the kids and the wife would be safe out in the suburbs and able to exercise and grow food. And that's a really interesting kind of perspective in today's land, that they're in the same situation again now. And we could call this largely an urban disease. It's definitely urban centres in Australia that are struck the hardest and the fastest. Though overall Australia is very low on the curve. We've hit 65 deaths today. That's an increase of 2. And it's been generally 1 or 2 deaths per day for the last week. So going fairly slowly for now, which is a blessing, and you wonder how much density is playing a role in that. But not to say there isn't solutions for denser cities, there definitely are. And as Cristian mentioned, examples like Singapore and other Southeast Asian countries, which may have in fact been more prepared for something like this because of the SARS pandemic that had previously impacted them. So I guess the question for us is, what difference will this make for us in planning cities in the future? Will this be a gateway to change? And I like to quote that should come up on the next slide as to what will this change, because pandemics have changed our thinking so much in the past. Might need to do it for me, Tom. It's really laggy. There you go. So that's the question I took away, and just comparing, I guess, life in suburbia from Melbourne to what it was when I lived in London, and what I'm now appreciating in that kind of suburban life. So some of you may have seen The Castle. It's a famous Australian movie about how a home is a castle, and people do love their front yards, their backyards, and their little quarter acre of heaven in suburbia. And I think that privilege of having space has just really been hammered home in this crisis, where those that have a garden or access to an outdoor area have really felt the benefit of it. But also those who have access to a spare room or extra space where you can work from home. I'm sure you've all felt the impacts of really of effectively feeling like you're in an overcrowded environment if you're sharing too much of the same space with others. And it really is those that are suffering the most are those in the densest environments, or in an apartment space, or in shared housing at this time. So we're really reinforcing those social privileges. The other thing is open space. It's definitely the open spaces that are near me are packed to the brim. Everybody is exercising as much as they possibly can as a result, which is great, but that's just been a savior. And I noticed street trees in particular popping up on my Facebook feed from London as spring seemed to have sprung. Everyone was taking photos of the lovely blossoms and really appreciating that access to nature. And it is, you know, time and time again, so many studies have proven that views of greenery, views of water, access to open space is so important to mental health, so important to physical health, and to make people get better. So hospitals that have a view of green space are showing that patients get better quicker. We've got the evidence, and will this push us to place more emphasis on open space planning? Can you click that one through, Tom? There was a really interesting study in Denmark recently as well, that actually children who were exposed to more open space and greenery in childhood are actually more resilient in their adult lives to mental health problems. So it's not just where you live in this moment, but it's where you grow up and those kind of environments that make an impact on you. Yeah, next one. For Melbourne in particular, that is so CBD centric, where we've got everyone travels into the centre, all trains lead to the city. Crosstown movement is actually really difficult. It really begs the question as to whether the CBD is an outdated kind of concept. I'm sure rent spaces for commercial properties are taking a nosedive at the moment. And will they come back as we learn to work from home? Will we just get used to working locally, making the most of virtual meetings, but actually enjoying our neighbourhoods and making the most of our local facilities? So could this be the birth of the true mixed-use neighbourhoods, where you have everything you actually need very locally? Click the next one. So that begs the question of, do we really, I mean, we're seeing huge roads and highways that are so quiet that people have taken over the streets, are also walking down the middle of the street to help with social distancing. We're seeing blurring of the boundaries with roads in particular, but will we also see blurring of the boundaries with private and public space, and also buildings? So that flexibility that we may see, and we've already seen with certain event centres turning into hospitals. Do we need to rethink less used parts of our neighbourhoods and how they could be used in the future if we're spending more time locally, to make things more interesting, to give people more things to do locally, but in that kind of safe environment? And will there be more of a focus on local resource planning? So the local Bunnings in Australia, they're all sold out of seeds and plants. Everyone's really digging in literally for the crisis, growing food. I think that kind of stemmed out of a supermarket panic to start with, that we needed to buy our own food. But that really comes into, I guess, a trend that's been building for a long time. So focus on localism, a little bit of a distrust of centralised authorities, and returning to the neighbourhood, returning to your neighbours and working with the local community, and how much we can do that in the future and integrate our own resource management, whether that be food, water, energy, I think could be an exciting opportunity that arises out of this. So yeah, that's it from Melbourne.
Fantastic, thank you, Celeste. We've also got, I finally worked out how to use the question bar. I was worried no one was actually out there listening. We're getting some really good questions coming through that I think we'll address as we get into the Q&A. So we're moving on to Auckland first of all with George Weeks. George, let me just check. You should have the control. Is that working?
No, I've got Celeste's slide of the castle on my screen.
Oh, right, okay.
Tom, I think my computer's not very helpful. You're going to have to advance the slides, so it's going to be like an old-fashioned university lecture. Okay, so it should be the title screen for mine, is that right?
Yeah, that's up.
Okay, next slide, please. Okay, so good evening, everybody from New Zealand. Next slide, please. That should be a map of New Zealand showing Auckland at the top of it and the fact that it's slightly larger than Britain, but with a population of just less than 5 million. Next slide, please. About half the New Zealand population lives at the very top of the country in the Upper North Island. And next slide, please. I mean, really, it's a very, very uneven distribution of people in New Zealand. About a quarter of the country is up in this top left-hand corner, which is basically where Auckland is. Next slide, please. Tom, is it a aerial photograph of Auckland? Hooray. Yeah, so yeah, New Zealand's a very, very urbanized country, more so than Britain. And next slide, please. Oh, my fantastic. I've actually got the slides on my own computer. Amazing, but quite a bit far behind. Okay, next slide, please. Should be boat sailing under the Auckland Harbour Bridge. Is that up? Cool. Okay, yes. And yeah, Auckland's very much the city of sails. I think it's got the world's highest per capita boat ownership after Monte Carlo or somewhere. But obviously this has all come to a stop at the moment because of COVID-19. Next slide, please. And I mean, in the same week that the rest of the world got COVID-19, it was the same for us, that last week of February. And New Zealand, what's significant is that we acted very, very quickly. We started having restrictions on people coming into the country from the middle of March. Next slide, that should be black and white photograph of the Prime Minister. And it was very much the case that we realised that if we're going to have a chance of beating this, we need to lock down early. So 21st of March, next slide please, it should be showing the alert levels in New Zealand. The government introduced a 4-level system for this determining what kind of restrictions, controls you need to have to keep the country safe. And so we were at level 2, which was basically maintain social distancing and businesses remain open, but you've got to stay separate. But next slide, please. We moved to level 3 a couple of days later, and that was only for 48 hours before moving, next slide, please, to level 4, which, next slide, please, is full lockdown. You can leave your house to go to the shops, and the only ones that are really open are chemists and supermarkets. You can leave your house to go to exercise and to access healthcare, and that's pretty much it. So next slide, please, should be a graph showing 3 curves. And what's significant is that we went into lockdown on March 25th, and then you can see that the number of cases of COVID rose quite a lot, quite quickly, and then leveled off at a total of around about 1,300, which brings us more or less to now. Next slide, please. So what we have here is a map from the Financial Times of the coronavirus outbreak showing confirmed cases and death. And next slide, please. If you look at the New Zealand number of cases and death, it appears that the country has had a lucky escape. And then next slide, please. Again, show a whole load of countries, a whole load of lines of number of new cases. And the New Zealand new cases peaked very, very early, and it's been going pretty steadily down since then. And so currently we're talking about what's going to happen next. Next slide, please, should say 23rd of April, question mark, alert level 3. I mean, we're talking that might happen next week. We don't know yet. It's going to be an announcement on Monday, but that's still an emergency situation. Next slide, please. Emergency situation, you're still meant to work from home, and like, most shops are still going to be shut. Next slide, please. The overarching aim of New Zealand is to eliminate COVID-19. Does it say that on the slide that you've got? Good. Okay, yeah. Mine's about 7 slides behind. Fantastic. Okay, and so, but I mean, if we're eliminating COVID-19, the question, next slide, please, is really how do our cities function? And I think as far as what we do professionally as planners and designers, next slide, please. It's significant that essential personal movement is very much one of the requirements of streets and roads and parks and public spaces in New Zealand. And next slide, please, showing Ponsonby Road. This is one of the main roads through Auckland. And normally you'd have 2 lanes of cars in each direction, buses, vans. It's always very, very busy. Here, the number of people walking, cycling, enjoying Ponsonby Road is more than I've ever seen it, because there's no other traffic. Next slide, please, should show hieroglyphics and a symbol for city or town. And I mean, this is a 3,000-year-old symbol for towns and cities. It's about streets bringing people together. I mean, that's what cities are for. And next slide, please. I mean, I'm sure many of us have been working from home over the past few weeks. And for some people, this was going to be the future with the World Wide Web. But the thing is, people do need actually to get out. I mean, even if you can work from home, you need to get out to socialize, to exercise, to keep yourself mentally well. So next slide, please. The main challenge for us is how do we transform streets to support active travel and now physical distancing. So next slide, please. What the New Zealand Transport Agency is doing is a national program, next slide, please, for using tactical urbanism, pilot pop-ups, interim treatments to make it safer and easier to use streets. So really, what can you do to make streets accessible quickly for as many people as possible? In Auckland, we've been doing this for a few years now. Next slide, please. We introduced
Oh no, George, we've lost you. The internet has gone down, I think, in Auckland. George, can you hear us? No, we might need to come back to George. George, okay, Aude, are you able to kind of pick up?
Yes, absolutely. Well, I'm okay. Sorry about the technical issues, and I'm sorry I have to sort of take over on with such a great presentation. In any case, I don't have slides, but what I'm going to try to do is perhaps to wrap up a little bit on what's been said already and focus on sort of the 3 main issues which have been the thread of the presentation so far: the issue of preparedness to the crisis, the issue of densification, and the issues around the future policy implications of the COVID pandemic. So perhaps, unless we manage to get George back, but I don't think that's the case, right? Okay, so I'm going to...
We'll try and get him back to finish off. But if you...
So I'm starting with perhaps a first question, which is, should we have been better prepared for this pandemic? And I think this is an important question, which very much deserves, in fact, a nuanced answer. So yes and no, in fact, because no, all pandemics are different. So we can't possibly be prepared to respond to all of them from a public health or from a planning perspective, simply because the epidemiological aspects of disease, the transmission routes, the transmission rates, the incubation periods are in fact unpredictable. Now, having said so, it is also true that despite the original, the symbiotic links between planning and public health, there has been actually a focus on a chronic disease rather than infectious disease from a planning and from a public health perspective over the last 3 or 4 decades, perhaps. So what I think is very interesting is that the current pandemic really brings the question of planning for infectious disease back to the forefront, and then raises important questions from the future of the practice of research and a practice of planning. The second question, which very much touches upon what Cristian and Celeste have already talked about, is around densification. Has the planning policy focus on densification compounded the health crisis? Again, another important question, and again, I'm afraid, another nuanced answer, I suppose. Clearly, densification is and has been a problem with COVID-19, and the virus, I suppose, puts a fundamental challenge to how we will manage urbanization in the future. But again, so having said so, it's worth bearing in mind that countries or cities with the highest levels of densification have not suffered the highest death rates. I think we've heard about that already, but it's worth perhaps mentioning that Singapore, for instance, has avoided the worst of the crisis with widespread testing, for instance, isolation and clear communication. South Korea, one of the countries worst affected by the disease, has also posted some of the lowest mortality rates, an achievement that can be traced in part to a series of technological innovations, including, controversially, the mapping and publication of infected patients movement, also used in China with the help of tech firms such as Alibaba, for instance, to track the spread of the virus. Also, I think let us not forget that despite media coverage, perhaps we've been a bit too biased towards global city, but non-global cities, tertiary cities, and peri-urban areas, as in Italy, for instance, with lower density rates, have also been affected and played a crucial part in infection transmission, which very much, in fact, reveals the complexity of our urban systems. So overall, COVID-19 has highlighted the need to design buildings and wider neighborhoods that enable people to live and socialize without being packed like sardines. But I would like to say that this is not necessarily something that planners didn't know before. Now, moving on to the last questions around policy implications. What policy changes should we be making when we come out on the other side of this crisis? Well, I would say, first of all, that perhaps it's a bit too early to take on the lessons learned from COVID-19. However, I think future policies are likely to be influenced by a renewed emphasis on environmental, technological, regulatory, and hopefully participatory considerations. And I'm going to look at each of them in turn. The first policy consideration is likely to be about mitigating the impact of the health-related challenges raised by COVID-19, especially social distancing and isolation in the context of climate emergency and sustainability. And this is a point which has already been made anyway. The second policy consideration, I think, will be about defining the scope of what the digital response to future pandemics ought to be, bearing in mind that considerations about data privacy will influence the way we plan or we do not plan future cities. And an argument which I've heard a lot actually in the media is that, well, modern planning as we know it and civil engineering were born out of the mid-19th century development of sanitation in response to the spread of malaria and cholera in cities, and that perhaps digital infrastructure might be the sanitation of our time. Digital infrastructure means very much the identifying people who are actually at risk of carrying the disease. So the tracking of people. Now, do we want or we do not want to go there? That is another question which goes beyond sort of the remit of planning, but will have an influence on the way we design and plan future cities. The third policy consideration, again, this is a point which has been touched upon, is an economic and regulatory one, will be about carefully balancing the need to accelerate financial recovery with the need to scrutinize the quality of the decisions being made. I think an important point will be to avoid the temptation to deregulate planning decisions even more, with the hope to sort of speed up economic growth, because we might end up in a position where decisions being made are actually of very poor quality themselves. And finally, I think this is actually a point which I haven't seen at all covered in the media by planning experts or designers or architects, and I think it's a very important one. I think whichever models is deemed to be best by public health professionals, by planners, by architects when we come out of this crisis from a public health perspective, what we should also perhaps try to avoid is a complete top-down approach to everything. Because just a few months ago, if you think about it, participation in planning was held as something very important. It took us a long time to get there. We're just celebrating the 50th anniversary of the Skeffington report. And I think that people who have gone through this crisis, they also have an important idea of what works and what doesn't work from a health perspective for them. And one of the things that whatever policy decision we make, we need to actually listen to the people as well. Let's just not forget that. That's it from me.
Wonderful, thank you. Right, so George, are you back? George? No, I'm not sure we're gonna hear much more from George at the moment. Right, it's just a blur to me. Anyway, we've had a lot of really good questions, so thanks everyone. We'll try and get into them now. We were going to run a few polls actually, just to kind of try and get a bit more interactive. I'm just going to try this. So let's try a first question for everyone. Let's just see if this works. So this is, do you think planning policy in London and other cities will fundamentally change after the pandemic? So we're collecting responses at the moment, and we'll see how that goes. So I don't know whether anyone else can see. I can see it, but it's actually quite interesting. It's kind of 50-50 between yes and no for everyone, which is quite interesting. So just kind of passing on to the panelists, and I guess it'd be interesting, Celeste and Cristian, just to kind of get your perspectives to whether you think it will change things where you are, and and reflecting on what you kind of know about London.
Yeah, sure. I really think it depends on how long it lasts, how much we bed in these changes. I think everyone's shocked at, a month ago we could never have imagined where we are now, but equally in 6 months' time, if we're still in lockdown, I think we will fundamentally change our habits and even start to rethink our neighbourhoods and slowly change things as to how we interact with them, and that could lead to some permanent changes. But if we suddenly look back in a couple of months, and I expect we might go back to business as usual fairly quickly, and hope that it doesn't happen again.
Great. Cristian, any reflections?
Yeah, I think as Celeste was saying, I have a fear that we're all thinking the right things and are keen to make changes now, but when we're allowed to leave our houses and go back to normality, that we'll just forget all of the struggles that we experienced. And I think there is some potential here that we as professionals should be, regardless of what everyone else thinks, we should be making sure that we keep these kind of issues in the forefront of our minds when we're planning for long term, and then also just bringing it to clients, or if you're in cities, that you're bringing up these topics with people We need to keep talking about it. We need to make sure that we are prepared, although as was said before, we can't plan for every eventuality, but without any plans in place to respond, we're just going to be reacting. And as we've seen, countries that react are much less effective than those that are proactive with these kind of situations.
And any further, I mean, particularly from the UK perspective, or the England perspective, the London perspective?
Again, I think it's too soon to tell. It's also very difficult to predict the direction in which the change will happen, whether it's going to be positive or negative. I mean, being French, perhaps I have the tendency to look at the glass half empty. So I'd say that maybe in the short term, we might see a bit more sort of flexibility, deregulation, which I've already mentioned in the presentation. But maybe in the longer term, I think there is also a possibility for health or health impact assessment, perhaps, to be taken into account a lot more in policy decisions, which is a trend that planners and public health professionals actually have advocated for a long time. So there's also good reasons to be hopeful.
Right. So
can anyone hear me?
George.
Yeah.
Can you hear us?
Loud and clear. Sorry, just checking. Carry on.
Okay. We're just going to go on. I mean, I think there's some really interesting perspectives there, and I know, you know, working in a kind of in an urban design practice, we've been talking about whether things will fundamentally change. I think there will be. It feels that there is already a knee-jerk reaction to the densification and the idea of kind of you know, people wanting to go back to cars and safety, which actually I'm not sure, you know, as a talking to people in our office, I don't think we really quite buy that. But I think that could become a big thing. I mean, the other issue I think in London is actually about access to green space, and the fact that, you know, I think Cristian and George both shared that, you know, in San Francisco and the Bay Area and in Auckland, they've already given up a lot of road space to people. Walking around South London, no road space has been given up, and cars are going faster than other people. I know people, I think Annie on the questions has raised the point that actually we need to think about access for disabled people. So there's obviously a big balance between this kind of balancing up between pedestrians and vehicles. But it feels to me we could be doing a lot more, and this could actually be a big opportunity to change things. I'm just going to launch the next poll. So the last one is 53%, I think, thought that would change, and that was a lot. It's kind of more or less 50-50 between people who thought there would be change and wouldn't be change. That's quite an interesting one. We're just going to have another one, which is what types of should change, and I think whilst we do that, perhaps, I mean, it'd be interesting, having worked in a low density city and a high density city, you know, what you think, you know, what lessons London could be learning. If that makes sense.
Sure. Well, I guess London is held up as an example. It does high density pretty well, and make sure that open public space is there. But I've definitely appreciated having private green space, and I know that planning open space is often seen as a substitute for that private space. But I think in times like this, it's definitely appreciated just to have that little, even if it's just a balcony, just, you know, a little bit of space to yourself. That's when open spaces may become completely utilized and overcrowded in some ways. That's definitely something I've noticed in comparison very strongly, that at the moment I'm a bit of a suburban fan. I wouldn't have been so much a month ago, but it's definitely got its downsides, and I think those downsides are mainly around lack of facilities in the suburbs and the huge commuting time. Definitely the people in the outer suburbs of Melbourne, they spend hours commuting, they have no family time. But if they're working from home, that all changes. So if they've got the right facilities locally, then I think there's a really good balance to be struck in that kind of medium density scenario where you've got facilities on hand.
Yeah, and I don't know what it's like in other cities, but certainly, I mean, it's clear there's a big issue about inequality. So, you know, where we do have kind of a lot of suburbs that often mix into where I live, there's a lot of high density council estates mixed in with kind of 1930 stuff. I think this point was also made by someone on the questions. So actually, there's a lot of inequality when it comes to space, which I think is quite prevalent in London. Do you think that's kind of similar in places like San Francisco as well, Cristian, and perhaps Auckland, George?
Yeah, I mean.
Yes, I think.
Go on, George.
Go on, George.
Okay. I think in Auckland, I mean, it's a city where some parts of it are very, very well served for parks. And Auckland has lovely parks, lovely green spaces. They aren't hugely evenly distributed. Picking up on Celeste's point, I think the thing about suburban private open space is very nice if you have it, but it's inherently exclusionary. So in terms of the public good, I think, yeah, the quality of public space is very, very important. And I mean, and that does bring me on to what I was going to say when my slide, when my voice disappeared at the end of my presentation, which was that the biggest component of any kind of public space in almost any city is roads and streets. And in terms of, yeah, not everyone has a park on their doorstep, but everyone has a street on their doorstep. And the potential for delivering significant public benefit by virtue of reallocating space away from private traffic towards every other function roads can do is very, very significant indeed in terms of the function that city spaces have to perform in terms of allowing access through the city and for recreation and so on.
Oh, George, we've lost you again.
Pass.
We've closed the poll now, and I think it's quite interesting what people responded to. I think everyone can see that. The big thing I think people are interested in is actually this reduction in road space, much less question about the reduction in and emphasis in density, and perhaps what everyone's seeing as people working from home. Some of the aspects and some of the questions that were coming up is linking into the way that the economy. So obviously there's the tragic health implications and everything, but you know I think probably what a lot of people are really worried about at the moment is their jobs and the economy going forward. We've got our final poll question. Hopefully it makes sense. I had some feedback that perhaps the last one didn't make as much sense as it should. But the question is, we knocked these up just before, by the way, so apologies if they don't make sense. The next one is what planners and the planning system will have in simulating the post-pandemic economy. So let's try this one whilst we talk. I think we've spoken, and actually, you know, I'm very pleased to live in a suburb of London where I've got a garden, parks nearby, but importantly a town centre, which has never been as useful, and actually kind of shopping in some of the independent corner shops I'm finding. Perspectives from elsewhere in terms of how this could perhaps change, and I think this is the point that Celeste made around the kind of a focus on localism and neighbourhoods. I don't know if anyone's got anything to add.
Yes, can you hear me?
Yeah.
Yeah, hurrah. I think rather like Melbourne, I mean, Auckland is a very spread out city, and what we've really noticed over the past few weeks is the importance of convenient neighbourhoods. Can you get things without having to go to the other side of town? I mean, Auckland's very spread out. People will drive quite long distances to access facilities and so on. But now, with many more restrictions on how you can get around, people are actually looking much more carefully about, is my neighbourhood actually convenient? And with the reductions in general traffic, people are walking a lot more in the neighbourhoods. They're going by bike a lot more in the neighbourhoods. They're combining exercise with running errands. And I think that the idea of the 15-minute neighbourhood is gaining quite a lot of traction. I mean, maybe the same in Melbourne.
Someone's mentioned the idea of lifetime neighbourhoods. Is this something that should become the focus of all of our planning? Is that what our emphasis should be in future city approaches?
I think it's a really good pressure test for neighbourhoods. That's right. I mean, it's people are living in their neighbourhood 24/7 at the moment, and that's the perfect pressure test as to whether a neighbourhood works or not, rather than just becoming residential suburbs where you go home to sleep. And I think from that perspective, it's a really good test.
Yeah, and I think, Tom, to your point earlier, this issue of equity, I think many of us here are fortunate enough that we live in neighbourhoods where there are facilities close by, or we have a car that we can drive to a facility. What this pandemic is demonstrating, unfortunately, in the Bay Area is these huge numbers of people living in communities where there isn't a supermarket. They don't have access to a car. So in these situations where they just want to do their normal essential food shopping, their only option is to get on the bus or to take public transportation. So they're putting themselves at risk every time they want to do these essential services that we probably don't even consider. We just, you know, I walk down to any one of 4 supermarkets within 5 minutes from my apartment, but not everyone has that luxury. So how do we bake in equity into all of the planning that we do, and not so that it's just a privilege of a few? And this is coming from years of, like, the Bay Area built a significant number of freeways over the last 50 years. And unfortunately, they split large numbers of communities, and for the most part, are disadvantaged communities, from each other, and then also from these facilities that we all take for granted.
I think this is interesting, particularly in the design of new communities, and perhaps Aude you could kind of chip in. So, you know, you look at the average new build urban extension in the UK, and there's actually very little facilities, or the facilities are put in much later on. So, you know, the idea of garden suburbs and towns and that sort of thing. So actually, should we be insisting that the facilities are kind of plumbed in close to home from the start? Should we be much stricter about that when it comes to planning? Aude, I think you're on mute.
Oh,
Sorry,
no, I
yes.
mean, I was agreeing. I can say more, but
Sorry,
absolutely. Yeah. Yes, let's build 15-minute neighbourhoods, that's all.
15-minute neighbourhoods. Aude, do you agree with that?
Yeah, absolutely, and not least because the 15 minutes neighborhood also is now strongly advocated in Paris. I think Anne Hidalgo has actually, the mayor of Paris has actually said that she's now going to aim to actually implement the idea in Paris and all around it. And yes, of course. And what I think is that actually, I mean, we know about the good sort of normative principles around health and planning. They've been around for years, for sure. I mean, we know that if we have sort of compact, walkable neighborhoods with access to facilities, people are going to live like happier, better lives, and so on and so forth. I think what we've always lacked really was the sort of the traction to transform this into some sort of actions to enable to make the change. And I think that perhaps there is a silver lining in this crisis, and by demonstrating that people can actually work from home, well, perhaps this will be the first steps towards implementing a neighborhood where people can have actually access to a lot more amenities and live different lives. The crisis will have shown that we can do all that. Sorry.
Great, thanks. I'm just sharing the last poll. I think it's good to see that 91% of us think that planning will play an important role, with a focus on perhaps fast tracking and delivery through housing and infrastructure. So that's good. So I'll just hide that. Right, we're nearly out of time. So I think this has gone as well as could be expected. A few technical issues, and a lot of questions that have come through on the chat, which I don't think we're really going to have enough time to answer. So maybe next time we need to do it for a bit longer. Is there any kind of final points anyone wanted to make before we close? And incidentally, we are recording this, so hopefully we'll be able to share, and we'll share some of the questions and the points that people have raised as we've gone through. Cristian,
yes.
Well, George.
Just a quick plug for the New Zealand Transport Agency Innovating Streets for People website. Go take a look at it, NZTA Innovating Streets, look it up and see if you can make it happen in where you work and live, in your own city, in your own country. It's a really, really good idea. That's all from me.
Yeah, and it's interesting how Auckland is now kind of powering in terms of good urban design, way beyond, I'd say, what's happening over here. Cristian, final view, you can probably go back and have a few hours sleep before you have to get up.
Yeah, that might be, yeah, that's the plan. I think my final thing is really just that, and we kind of discussed this before, that we don't allow the lessons that we are learning from this situation to fall into short-term memory or it's just forgotten. We need to keep these things in our minds as we're planning for things moving forward. We don't want this situation to happen to the same extent that it's happened now, and maybe there are things that we can be doing and setting things in motion that would help us in the long term.
Great. Celeste, you can go to bed again for tomorrow.
Thank you. I think closing message is just let's use this as a platform. I think people might be turning to planners over the next couple of months for opinions, and because we're all noticing the places that we live in more and more, and what's wrong with them, what's right with them. So let's get some messages out there. As you say, it's good planning principles that have been around for a long time, but maybe aren't implemented that well. So let's take that opportunity.
Yeah, I think that's about the crux of it, really, isn't it? You know, it's all been thought through. We just need to do it. You know, it's all about implementation. Okay, thanks. Have a good sleep, and you can go and get some lunch after this. But any thoughts from you?
No new thoughts. We just to really summarize to the extreme, but the two most important points for me, really, like implementing, as Celeste just said, like the good principles which actually have been around for some time and that planners have been advocating for actually a long time. And the very last point, let us not forget the views of the public. It is also we're all going through this, so we also really need to listen to what people have to say and suggest, because they were the first one to be affected.
Yeah.
Yes, absolutely. Yeah, we have not got all the ideas. We can engage with people that have. We can really make good things happen.
Thank you. Right, well, I would like to thank all of our panelists for joining at various different times of the day and the night from around the world. And apologies that the technology isn't quite there. I think it's one takeaway for me is it's very good that this is happening in the year 2020, not 10 years ago, because actually I think the economy would be going into halt, and we certainly would be able to be talking to each other in the future. I think we've had some pretty good feedback from people, so there's been about 200 people listening in, and thanks for sticking with us, everyone. We'll try and make it a bit more interactive next time. Our next session is going to be, or our next Ideas Exchange is due in 2 weeks' time on the 1st of May at the same time, Friday lunchtime, where we'll be talking about urban design in London and whether London is designing to be beautiful. So thanks to everyone for joining us, and we'll try and share some of the material that's been created, and we will hopefully see you all soon. And hopefully this will be the point where we all have a drink. You know, have a drink. Why not? Safe, everyone. Cheers.
Thank you.
Bye.